Hey guys, this is Dr. Barber with SI Institute. Got the new Carestream 3700 here. We're doing a scan on our patient, and I wanted to show you guys how easy this really is to do, okay? So, we got our patient in. She's got an implant that looks beautiful that was placed through the Institute. It's ready to be restored. Now, you have a couple of options. One is you can go analog, which means, do I do closed tray? Do I do open tray? What kind of tray? And then all my impression material. Or you can do something that's a lot easier, right? You use your Carestream 3700, you scan an implant body, and then that sends it right over to the lab. Now, you might be wondering, why would I do this? First, it's super accurate. You're not gonna mess this up. You're not gonna have bubbles, you're not gonna have voids, you're not gonna have tears. Everything is sent directly to the lab, right? Second is you're gonna save on costs, right? You can reuse your implant scan bodies, and you can also save on materials. So let me show you how it works. If you come around over here, I'll show you. We got it set up already. We scanned the top arch. Now we're gonna scan the bottom arch. It's implant number 30. So we're gonna go here. First thing, we're gonna click on scan body. Scan body is gonna allow us to scan the tissue and the teeth, and then we're gonna cut that out with this button right here in the middle, and then we're gonna scan the actual scan body, okay? And I'll show you guys what that looks like. So let's scan the tissue. I'll have you come over here. So we're looking at site number 30. I'm gonna dry this off a little bit. Nadine, will you blow some air on that for me? Perfect. I'm gonna turn the screen so you guys can see here. Now, with the scanner, you're gonna wanna have a warm up for 2 minutes. It blows hot air on the actual lens here, and that helps with defogging. So you're gonna wanna make sure you turn it on 2 minutes before, okay? Now, we got this set up. I'm gonna start scanning. My scanner's ready to go. You can see the picture here. So let's rock and roll. Nadine, I will take some air from you. Perfect. Okay, we'll go ahead and start this off. Now guys, see how smooth this is? Tissue looks beautiful there. Looks gorgeous. Emergence profile is going to be really nice on this crown. Shells in like this. Okay. Good. Now, you could do the full arch or you can do a quad, depends on what the tray or what your lab is looking for. But we're just going to do a quad here for simplistic purposes, so we can show you what this looks like. Awesome. Now look at the amount of time we're saving on this. I've already got the quad done here. Perfect. Okay. Now let's take a look. When I stop, it recognizes that. I put the scanner back in the holder and I look at my scan. See where I'm looking for here is a nice emergence profile coming out of the tissue for the lab to recognize. That looks beautiful, you guys. Now it's telling me I may want to scan over the incisal edges here, but I'm looking at those and those look pretty good. Okay, so now the next step is we're going to cut a hole out. Okay. Just going to copy our data, and then we're going to cut a hole in the area, and then we're going to rescan it with the scan body. So let's do that. Perfect. Now, for the scan body, we're going to put our scan body in. So, the scan body is what recognizes where the implant is according to how the abutment is going to come out of the implant, and that's what the lab uses. So they'll put this into the die, pour it up. The analog will be on the bottom side of this representing the implant, and then you have a perfect transfer from this to that using digital versus old school, right? Okay. So I'm gonna put this in Miss Michelle's mouth here. Good, you wanna make sure it's down all the way. Perfect, there we go, I felt it click in. Now you just twist the top of this. Okay. Now guys, that's gonna be our emergence profile for our implant. Do we like that? Oh yeah, we like that. Nice space between the premolar in front of it. And we're gonna get a nice crown for our patient here. She's gonna be happy with that. Got some nice tissue profile as well. So now let's go to the scan part of that. So I'm gonna take this scanner to the body marks here. And we're gonna scan in the new data using our Carestream dental scanner. So now we're gonna rescan with the implant scan body here. Nice. Looking good. So we're just focused on that area. We don't want too much data. Looking good. Make sure I got the mesial of it. Nice. Okay, that's it. Now, I'm gonna check this really quick. Looks pretty good. We'll cut out all of this extra stuff on the side here, her cheek and tongue, but it looks pretty good. They can get a nice little detail there. I might want to scan a little bit of the distal for you guys, get a little bit more data there. Will you blow some air there, Nadine? Mm-hmm. Perfect. Nice, I got that really nice there. Perfect. All right, mesial looks good. Good, let that pause to catch up. Put that back in its holder. Nice, so now, guys, look at how easy that is. Looks really, really good. Okay, so then the next part, you would go through the check process, make sure everything matches up, do your bite. Actually, I could do your bite for you real quick here if you guys want to see that. Okay, so that's good. That looks good too. Okay. Actually, don't have to do that. All right, so we're getting this ready to send to the lab. Now you can send a standard bite, you can send a digital bite. Obviously, we're gonna send ours digital, but you guys see how quick that is. And the reality of it is you're gonna save money, you're gonna save time with the patient. The patient's gonna be happy because you're not getting it messy, and everything's gonna turn out beautiful because it's really, really accurate. So we just so happen to have what we did for Miss Michelle here in the office. And I'm gonna take this off of here. And we tried it in, so we actually have the crown back here that we did digitally. And that's what that looks like. We did a screw retain through the top. Looks beautiful. We got an x-ray of that. And the x-ray looks beautiful as well. Let's take a look at that. So margins look nice, nice emergence profile coming out of here. It's gonna do her a lot of good and turned out to be a great job. So if you guys have any questions, check out the Institute or find your local rep to get interested in the 3700. This is the wave of the future, guys. Jump on the train, all right? Appreciate you.